I'm a practicing gynecologist at Bangalore. Today I will be discussing about cervical cancer vaccine. As we all know, cervical cancer is one of the main cancer in the women. So this cancer is caused by a virus known as human papilloma virus. There are various strains of this virus, but the most important ones are 16, 18, 31 and 33. This virus over a period of time can lead to the cancer of the cervix. To begin with, once a woman becomes sexually active, this virus infects the cervix. It makes changes in the cells of the cervix, and slowly the infection gets cured over 1 to 2 years. But if the infection is persisting, then after 10 to 20 years, this can turn into cervix cancer. This cancer is life threatening, and usually it is not detected in a very early stage. That is why it is very important to prevent this cancer, and we are all lucky that we have a vaccine for this cancer, and this vaccine is called as cervical cancer vaccine or HPV vaccine. There are two varieties of HPV vaccine. One is Gardasil and the other one is Cervix in India. What is the ideal age to vaccinate women against the cervix cancer? The ideal age is 9 to 13 years, so that the vaccine gives maximum protection. The protection is almost about 98 to 99%. Why this age is selected? It is because once the virus has affected that woman, the vaccine may not be very effective. Because we know that the cervix cancer is caused by the virus, it is very important for us to prevent this viral infection. So we have to give the vaccine before the woman becomes sexually active, and that is when the benefits are maximum. Many people ask, is it okay if we give the vaccine after the age of 15, after the age of 20, after the age of 25, or after the age of 30? Yes, it is advisable for women to take the vaccine up to the age of 45 years, but the benefit will reduce since most of the women will already be infected by that time. But the benefits will happen because even if you are affected with one strain of virus, the other strains can be prevented by taking the vaccine. So does usage of condoms protect against cervix cancer? Yes, if the condoms are used correctly and regularly, then the cervix cancer can be prevented. What is the cost of this vaccine? The vaccine costs about 3,000 rupees in India. And how to time this? What is the schedule? So the schedule is 0, 2 and 6. So if the woman takes the vaccine today, that is 22nd of April, the next dose is 22nd of June, and the next dose would be 22nd of October. But now there are studies which say that the vaccine has effect even if you take single dose. That is, even single dose of vaccine can provide benefit for the woman. Does the woman need to do pap smear even if she takes the cervix cancer vaccine. Yes, pap smear is mandatory even after vaccination, which has to be done once in 3 years. What are the side effects of the vaccine? Usually, there is no much side effect of the vaccine. There may be slight pain which may last for 24 hours at the injection site, but apart from this, there is no other side effects. Does this vaccine contain live virus? No, it doesn't contain live virus. It just has a protein in it which looks like human papilloma virus, that is HPV. That is why your body will produce antibodies against this virus, and it behaves as if you have got an infection but you are not infected. That is how it provides immunity to you. How much protection or how many years does this vaccine give protection? Usually, this vaccine provides protection for up to 10 to 12 years. And after that, you may need to take the booster dose. So, if you have already taken COVID vaccine, how long should you avoid, or how much of time you need to give a gap to take the human papilloma virus vaccine, that is cervix cancer vaccine? Ideally, there is no recommendation as such, but personally, I would prefer to give a gap of at least 15 days to 1 month before, after you take the COVID vaccine, to take your cervix cancer vaccine. So, how do you identify the symptoms of cervix cancer? There may be white discharge, which may be smelly. There may be bleeding after intercourse. There may be warts or cauliflower like growth in your private parts. So, all this can be one of the symptoms of cervix cancer. So, is there any other test apart from pap smear which can detect the cervix cancer? No, there is no other test. So, it is always better to get your pap smear done at regular intervals, usually once in 3 years. Is cervix cancer curable? Yes, cervix cancer is curable, but if it is detected early only, it is completely curable. Otherwise, the cure is not complete. So, what is the treatment for cervix cancer? It can be radiation, it can be surgery, or rarely it can be chemotherapy. So, many people ask whether you need to vaccinate your daughters or youngsters for the cervix cancer. I would say yes, the protection is more than 95%. So, I urge every parent to vaccinate their girl child between the age of 9 to 13. Thank you. Have a good day. If any doubts, please contact us at 95917 87988. Thank you so much. Have a wonderful day. Thank you.